Hi, I'm Corey. In today's scenario, we had a patient had a slip and fall in the parking lot. She fell on some ice. We are now inside of the clinic. The scene is safe. So now we're going to go on with a few questions, a couple tests, and some observation. So the wrist is based on observation, is swollen. There's a little bit of bruising. She is holding her arm up. I'm gonna ask for pain. So on a scale from 0 to 10, 10 being the worst and 0 being no pain, how would you rate this injury?
A 9 or a 10.
So it's a 9 or a 10,
Especially in my wrist.
especially in the wrist. Okay, so I'm gonna ask the patient if maybe she can make a fist for me, and she cannot. The most right now, for me, the most important thing to do is try to palpate the radial pulse to make sure there's no arterial occlusion, and I can feel the radial pulse. I'm going to splint this to help stabilize it, to make the patient a little bit more comfortable. Slide this out. I'm gonna ask the patient if she can help stabilize the bottom of this. Take my ace bandage, and I'm just going to wrap this up tight enough to keep the splint on. I'm using a SAM splint. And also to help stabilize the injury. Next, now that the patient's less guarded, what I'm gonna do is I'm going to brush your skin with my finger, and I want you to tell me if you can feel any of this. Okay, so the patient does have sensation. Next, I'm going to check capillary refills, see if there's an adequate supply of blood to the hand. It is. The blood comes back. I'm going to see if the patient can try, and I'm going to test the motor system here and see if the patient, nope, she cannot. So what I'm thinking here is that the patient might have a distal radial fracture. We do not have an x-ray in the clinic, so I'm going to refer her out for x-rays and to follow up with an orthopedic specialist as needed.